anything new and exciting you want to share, do that. So I'm John Nowak. I'm the co-executive director of CHIP, and I am about 6 weeks away from retirement. That's exciting for me. Lori, you want to go next?
I'm Lori Fleming, and I think my opposite of excitement is that John is retiring.
Susan?
Hi, I'm Susan O'Brien, nurse practitioner at the main clinic at Jefferson County Public Health and also the school-based health centers at Port Townsend and Chimacum.
And Dr. Parker?
I'm Molly Parker. I'm the one of my chief medical officer of population health and a family doctor at Jefferson Healthcare. We've had some good childcare news recently, or potential childcare news. I still am waiting to see it in writing, but that's exciting. So that's my big thing.
Dr. Parker, do you want to tell people about that?
We're allowed to. I did get permission, Molly.
Why don't you say it then?
Go ahead.
I'll do my best. It's a little complicated. So Kate Dean, Jefferson County, and Jefferson Healthcare's proposal for $2.5 million from a new earmark program through Senator Murray's office was advanced in her package for earmarks, which means if Congress approves earmarks this year, that it will be included in that budget. So it's very likely. It's what I'm told directly from Murray's staff. So very exciting.
And I think it's 1.5 million. On
was it only one?
Oh,
okay.
Yeah, on her listing. But you know who's counting.
Okay, great.
But can you explain exactly where that money would go? I'm not quite clear.
No, but that's the lovely thing about earmarks, is that it's general funds to go toward developing a new childcare center. So I guess that is a little more specific. And the goal is to move forward with the concept paper that we finished up with the Washington State grant that we just had. So it would be a 40-kid childcare, ideally with 4 to 8 infant slots, because that's a big need in the county. And so it would go forward to develop that concept. But specifically what that means, we don't know, because Jefferson Healthcare will not be opening a childcare. Just to be really clear, we need a partner to open the childcare for us.
Molly, it does make me think this group might be interested in the final report.
Oh yeah.
Might be good to give to John and Lori to distribute to this group, because it does identify some next steps, Susan.
Sure.
It could be fun.
Yeah. Yeah, Jenny got to read it. I think it's long and financially a little depressing, but yeah, I can send it over to Lori or John.
Well, that news is really, really exciting. Thanks for sharing that. Denise?
Hi, I'm Denise Banker, and I am the Empowered Teens Coalition Coordinator in Chimacum, and we do drug and alcohol prevention among school-age children and in the community. Thanks.
And Jenny? I think you're on mute.
Kids at Mental Health until August the 13th, and then looking for new opportunities.
Thank you. Julie.
Hello, my name is Julie Canterbury, and you all know me, but I'm the owner of MCS Counseling, and we are doing lots of different contracts. We're in the schools, working, partnering with school districts to provide more counseling in the schools, and we are also private practice in Port Townsend and Silverdale.
And Cynthia?
Hey, I'm Cynthia Osterman with the Benji Project. We're an adolescent mental health nonprofit.
And Alyssa?
Alyssa Rodriguez, Jefferson Healthcare Administrative Assistant.
All right. Lori, you mind bringing up the slides? So this is agenda for today. So we've already done introductions, and we're going to spend a little bit of time about potential additions to the framework, but the majority of the meeting will be reviewing the framework. We're in the last, we have 2 more meetings before we are supposed to have this work largely complete. And what's actually been working very well is I get feedback in between the meetings and kind of tune up the framework, and then you guys give us framework during the meetings. Lori's been doing a really good job of kind of taking notes on the framework during the meeting. And then, so today's focus will be kind of finely tuning up the framework and then starting on doing assignments, kind of who's potentially responsible for that action or activity. And then next time the focus will really be on making sure that we have kind of who's responsible for that activity. And then at the end, we'll just talk about ongoing actions. Laura, you were ahead of me, but that was the right thing. So Susan, do you, I know you are doing some work in the schools right now that I think is kind of exciting. Do you want to talk a little bit about that? Are you willing to do that?
Yes, I can do that. So Melinda and I, who are working at the school-based clinics in Chimacum, Coulson, and Port Townsend, have been really wanting to drill down a little bit on something that's called SBIRT, which has been around for a while. Basically, it's screening and brief intervention, referral, and treatment for substance use is where it started. But we were in contact with this, I think there was like a 5-year grant that got given to Vermont, where they have spread the universal screening of SBIRT through their whole state. And so we're exploring a little bit about, I mean, we do that already in the school-based clinics when students come in and include things like mental health and anxiety and resilience and all that. But there's a tool in particular that we're looking at that includes, in addition to substance use, they also include the PHQ-9, anxiety and resilience, and the framework, or the plan, or what they've been doing is they're screening it twice a year to all the students, like say in this, they sort of focus on 7th, 8th, and 9th. And it's like 10 minutes in class and you get this information. And at the same time, there needs to be partnership with professionals, because there's always going to be some red flags for certain students that need care right away. So we're just in the early exploration of how this is being done other places. And it's also being done in King County with a little bit different tool. But we're pretty excited about that idea, and reaching out to a little bit of school districts, seeing if they're even interested in something like that. And so that's kind of, I think, about all I have to say. Oh yeah, so this is a good little pyramid here. Of course, the severe at the top, many folks in the community know about who those people are. So this helps us be aware of those that are sort of, we're not aware of, that we see every day, that might be really struggling and having some mild or moderate risk levels that we can intervene at an earlier point. I think that's all I have to say about it, unless people have questions about it.
Susan, I'm just interested, is funding required for this, and is there an opportunity out there to go out and get that funding, or how do you envision implementing it? Or maybe that's too far in the future still. So,
depending on what, if there's interest, which it seems to me that in this time especially, it seems really a critical time. And what I really love about the particular tool we were looking at is that it's not just substance use, but it's the resilience and the protective factors and all these things are part of the screening. The tool itself is, it can be used in a paper form, or probably digital is going to be way more less cumbersome. There is a cost to that of maybe $5,000 a year or something, and I think the rest of it, yeah. So I don't know. It's still early stages, but I think because SBIRT and they also have motivational interviewing that's also incorporated in part of this tool as sort of moving forward. Because all of those are evidence-based, I think there's a lot of potential funding that would be perfect for this particular type of implementation of this plan.
Would you feel comfortable? To me, this feels like a pretty natural addition to the framework that we're working on right now, because I think that kind of broad-based screening may be really useful in terms of, suicide prevention among kids. So to me, it feels like a really good fit. Would you be comfortable if we, added an activity in the plan to support that?
I would love that.
I'm making a note now, John.
All right, perfect. Thanks, Lori.
Because as I reach out to the key people in the schools, mentioning that, the youth age band chip is also supportive, I think would be also really helpful.
And I think also, depending on what funding, we're seeking for some of these activities, we might be able to put that in as well. So that there might be an opportunity to do that. So yeah, I think it's a great fit. And does anybody have any concerns about that, about doing that?
John, I have a global question.
Fire away. I think you're muted again, Jenny. Sorry.
I don't know why it keeps changing. Gee, all of this really good work certainly impacts students in the school districts. I'm wondering if it would be a possible presentation to the school boards at some point when you feel like it's to the point where it could be a well-formed presentation, including, Susan, your latest project.
Yeah, I think that would be a pretty natural fit. And there is, Lori might help me remember what it's called, but there is I think it's, yeah. Is it quarterly or monthly that they meet? It's all the superintendents plus one school board member from each district. And that might be a good place to do that presentation. And I think that's a really good suggestion, Jenny. So
with two new
yeah,
superintendents, I was just saying with two new superintendents, it may be a new opportunity.
Yeah.
So, I had a quick question for Susan.
Yeah, go ahead, Mom.
We use the SBIRT in clinic. Is the Y SBIRT different?
The Y is just the youth version of SBIRT.
I was Googling it and I couldn't find the youth version. Do you mind emailing that to me?
Yeah, I'll do that.
Thanks.
So I think with that, we're kind of on to the framework. And, as I've done in the past, any changes I made between the last meeting and this one, I put in red in the framework. And what we've been doing kind of at this meeting is going through it kind of one last time for comments and additions, and then also looking at the responsibility column and seeing if there's somebody we can put in there pretty easily. And if not, we can triage that to the next meeting. But I'll just give a pretty high level kind of overview, and then just stop me if there's something that doesn't seem to work or fit with you. So the goal has been changed a number of times, but the most current version of it says, implement a coordinated framework of interventions that result in the elimination of adolescent suicide in Jefferson County every year starting in 2024. And then the objective under that, we had kind of flip-flopped between access and utilization and determined that it was best to put both. So it now says, improve the access and utilization of behavioral health resources for adolescents in our community. And this goal and objective is throughout this entire plan. So if you have concerns or questions, probably now a good time to bring it up. But it should, I'm hoping we're getting pretty close to having a a final wording on that.
John, a tiny, because I'm an old English teacher, a tiny little thing, if we're going to, because this will go elsewhere.
Yeah.
If we're going to capitalize adolescence, we should do it all the way through, but I'm not
Oh.
sure that's appropriate to capitalize it.
Yeah, that's great.
Sorry,
you know
tiny.
You know what I'll do, Jenny, is my wife was a copy editor at the Leader for 20 years.
Perfect.
So I will have her give me a ruling on whether to capitalize it or not.
And just a question about wording in the goal. As much as I would like to see the goal be met of an elimination of adolescent suicide, would it be better to suggest the result be the substantial reduction? I don't know. I don't know what other folks are thinking.
I know it's a conversation we've been having throughout these meetings. My understanding, John, was as we were talking about it, that we really did want to leave it at the elimination, because that, of course, is everybody's desire, is that it never
Sure.
happens.
Thank you.
Thank you.
All right, so the first strategy under that is to identify and execute a plan to improve the success of youth connecting and availing themselves of services within the community, family, and school services that support improved mental health. And the metric associated with that is 15 teens will connect with services that improve their mental health. And then there are several activities under that. The first one is a resource map of all agencies and organizations for relevant services, perform a service gap, and determine actions to address shallow spots. Any feedback on that? And I'm thinking for responsibility that this group would be the logical place to do that, because I think we have a lot of people that represent a lot of the services, and the ones that aren't represented in this group, I think somebody in this group will know most of those people. Does that seem appropriate?
I think this is well underway too.
Yeah, I agree. Okay. Thanks, Tanya. I got your thumbs up. And then the second activity is to develop a method to communicate youth-related efforts, support a clearinghouse of information and updates between providers. And Tanya, I'm wondering if, the work you're doing, if part of it is kind of looking at what services are available and being able to communicate that out to the community.
It is, yes.
Is it okay if we put you and the YMCA to do this one?
I would definitely want to be a part of it. And I just need to apologize because I'm on foot right now and mostly just listening in. And I haven't been part of these meetings for a little while now. So my apologies. But yes, I think that's a very appropriate role for me/us to play.
Yeah, and I want to be clear about something that I probably should have explained earlier. When we put the responsible party, it doesn't mean they absolutely have to do all the work, but it's that they're kind of the point of contact for that, and that they'll kind of lead that effort. So, so that lets you off the hook just a little bit, Tanya.
Thank you for the clarification.
Okay, Laura, you want to scroll down? I think you have to go back up for a second, sorry. Okay. So the third activity is support and augment ongoing efforts to develop family navigation in our community to better integrate services across community, family, and school, and improve how kids are served by all. And this was actually intended, again, Tanya, to kind of reflect the work that you're doing. That we want to, as CHIP, we want to do whatever we can do to support the navigation work that you're doing. And then if there are other efforts, support that, but we kind of saw the work that you're doing at the core of that.
I so appreciate you really keeping this work, my work in mind as part of the picture. And again, just feel that I've been so very absent as of late, and just really grateful for your, your integration. Thank you.
Well, you know, it is kind of a long-standing tradition. When you miss meetings, you get a bunch of assignments. So that's pretty much how this worked for you.
That's delightful.
All right. Now I think we can go to the next page, Lori. So again, same goal and objective and the same strategy are still in play here. And then the fourth activity is to bring ESD for help in assessing Jefferson specific action plans to reduce suicide.
John,
Yeah.
I'd like to report just a little bit right here. The coalition coordinators, Lindsay Scalf and I, have a meeting with DBH, Julie Canterbury, and Ciela Meyer, who is the ESD coordinator, regional coordinator right now, behavioral health regional coordinator. And we have a meeting scheduled on the 25th of August to clarify what has already been funded in the contracted and funded in the Port Townsend School District, what mental health suicide prevention programs are out there besides the peer-to-peer one that I've been talking about at the coalition meetings, and how we can get them funded. And so we have a meeting scheduled to kind of consider this 1A.4. And so I just wanted to let you know that.
Great.
Denise, will someone from the school districts be at that meeting?
No, not initially.
I see.
We are going to try to all get on the same page is what we're going to try to do. And so we want to see what MCS is already going to be, has already contracted to do at Port Townsend. And then we want to clarify all the various programs people are thinking about, talking about, and looking at, and then narrow it down to one that we can do in all three of the school districts, because now there's, or all four of the school districts, because now there are coalitions in all of the school districts. And so we know that the coalition dollars can't fund it because suicide mental health first aid training is not proven as a prevention measure for substance use abuse and in youth. And so that would be getting out of our lane if we tried to fund it because it's mental health promotion funding. And so we're looking to see what kind of funding we can get to support it. And we're very hopeful that we will get the funding. And we know that Chimacum is already on board in wanting this for all their students. And I'm sure that Quilcene and Port Townsend want it too, but we just haven't talked to them yet about it. Julie might know, she might have talked to them about it already. But we're gonna.
Oh, go ahead. I'll let you finish and I'll talk after you.
We're gonna suss all this out at this meeting on August 25th.
Ciela is from the school district, so she will be part of that. We are in the conversation with with all the schools right now, and so it's mostly in the mental health first aid component, and that's down lower. But Quilcene has pretty much committed to it. They just haven't had the full details. And I meet with Port Townsend School District in probably next week.
Who do you guys think we should put as a responsible party for this? And we have often put multiple responsible parties in. So, I mean, Julie, it sounds like you're taking some responsibility, and Denise, I'm not sure whether to put Empowered Teens Coalition or Public Health or Denise or Angie, or what do you think?
I think if you put Jefferson County Empowered Teens Coalitions, put it plural, since there's
Okay.
3 of them now.
And Julie, are you comfortable if we put MCS as well? Okay.
Thanks, Julie.
And then the next activity is develop an approach to gather insights from youth on how best to reach them and what services they need or want.
I don't know if folks remember, this came out of the work of our person from Idaho now, whose name escapes me. But I haven't been able to get connected back with her again to see what she ended up writing out about it. I've reached out to her a couple of times, but I'm imagining she disappeared into summer.
Wouldn't that be nice, disappearing into summer? That sounds really good.
So I'm saying that I know where this came from, but I don't know that we have anybody who thought, oh, this is mine, and I really want to.
I do think this is a pretty important one for us to, to implement. I think what Finn said when he was here was really powerful. And I think if this group goes on to continue to do work, it really needs some youth representation. And I think understanding what they think they need is really, really important. So,
John?
Yeah.
Denise, maybe the Skillmation mentors can, maybe we could reach out to Ben Bauermeister and see if the Skillmation mentors could maybe help us with this one.
Okay, that seems like a really good suggestion. Yeah.
The other possibility, Denise, and I know they're not in this call, but at least Chimacum and Port Townsend do have the ESD position. They might be able to take that on as well.
Right, and Quilcene will have that ESD position too very soon.
And they are very familiar with the schools and the students, and they might be the best ones to develop some kind of an assessment.
So the ESD position she's talking about, John and Lori, is the student assistance professional. And the person at Port Townsend's name is Holly, but I can't say what her last name is right at this very moment.
McIlvaine.
Say that again?
Holly McIlvaine.
McIlvaine.
Mm-hmm.
Thank you.
There's a new person at Chimacum, I believe.
And they just hired someone for Chimacum, and they're in the process of hiring someone for Quilcene. But those 3 people are all on the coalitions
right.
by virtue of their job description. Right. And so we can definitely reach out to them and get them involved in this.
Thank you.
And Susan asked the question, so there's going to be an SAP at Port Townsend, and I see.
Well, there is an SAP at Port Townsend, but she's in the middle school. There won't be one in the high school.
I Susan, think that your mute is on.
Yeah, I wasn't saying, I knew it was muted. I'm just saying, why isn't there one in the high school? It's ridiculous. Come on.
That's what we're saying too.
So, Dr. Parker, did you have a question?
Oh, I was just going to add that I think our thoughts behind that topic was thinking about a focus group to get a sense of what the students needed. And so just thinking about, is Skillmation a group that does focus groups, and would they be a good place to get that information? Or is that something that, public health would do, or, DBH, or who? I think in Skillmation has access to a lot of those kids, but maybe partnering with a mental health expert to get at the questions we want to ask.
Is everyone, I think what you just said, Molly, is really important to include in this activity. So is everybody okay if I add some wording around, focus groups may be included in this process or something? Are folks okay with that?
I am. I want to add that in the action plan for the Port Townsend Coalition, they have a position for a clerk hire that is tasked with holding focus groups among students at the Port Townsend High School. And that position hasn't been filled yet. We were initially looking for a student in the high school to hire, but we haven't had anybody who was identified as someone who might be interested not come to the fore. And then we haven't had any other applications. But to Molly's point about having it be a social scientist, someone who is adept at writing focus group questions that get to the heart of what you're trying to discover. I think that's a great idea. I don't know anyone around here who knows particularly how to do that. I know that Laura Tucker's good at it, but
when we did the community health survey, Denise, we had a University of Washington student come over who had skills in, putting together focus groups, and she was really excellent. And, she was kind of a combination of being a young person that could connect with younger people, but also had the social science background to be able to kind of back that up. So that might be an opportunity to investigate. Well, I think that one will end up getting massaged a bit, but I think that's all really, really great feedback. So activity 6 underneath that one is to develop an approach to create safe spaces for kids to gather in Port Townsend, Quilcene, Brennan, and Chimacum, and to execute that. And then the rest of it is kind of some suggestions about where to do that and how to do that. And I know that the CARES funding actually funded Port Townsend Conference Room already. And Tanya, I'm just curious, were you involved in that at all, or do you participate with that?
I do not.
Okay, all right.
Yeah.
Any thoughts about who might be the responsible party for this one?
It could be that the Y will play an active role in that, but yeah, I don't know about taking responsibility for it.
What about Parks and Rec?
I'm on the Parks and Rec Advisory Board, and I can certainly bring that up there. So that may be an opportunity.
And that would be a nice joint effort between the Y and Parks and Rec.
All right. Yeah, that actually, now that I think about it, that might be a pretty good suggestion, Tanya, to have those two groups together.
We're doing more and more partnering and sharing of facilities as it is, and so it continues to be a really good working relationship. So definitely put me in pencil for that area, and if there could be some co-leadership in that, I'd be happy to participate with Matt or whoever.
Yeah. Okay. All right, Laurie, next page. So still on the same goal and objective. but we're on a different strategy this time. And this is identify adults who interact with teens frequently in the community and train them on suicide risk identification and prevention. And I think it was Julie's suggestion that we had that at 20 and increased it to 50 at the last meeting. And so the first activity is to develop a list of adults who frequently interact with teens, and roles would predispose teens to coming to them. And Julie, since this is kind of in your wheelhouse, are you someone that might be the responsible party?
Sure. That's a lot of responsibility.
Yeah, I mean, again, it's not that you will do every class and do all of the trainings, but it's that you're kind of willing to put your name on the docket to kind of lead that effort and
sure, we do already have a list of entities that we plan on contacting with youth leaders for churches and in different organizations. And so we kind of already have something like that. I just don't want to do it all by myself.
Yeah.
Julie, I'm happy to help with any legwork, that sort of thing.
And then 1B2 is offer adult-focused suicide prevention training like MCS's mental health first aid classes to continue suicide prevention trainings currently conducted with the Olympic Angel Volunteers, the Chimacum Teen Center, Faith-Based Partners, Skillnation, and the Benji Project teachers.
Just for clarification, John, when you say offer adult-focused suicide prevention training, do you mean the training is focused on training adults, or that the training is focused on suicide prevention in adults?
It's focused on training adults to help adolescents.
Okay.
Yeah. Yeah, and actually we, there's one component of this that's training adults to work with kids, but there's another one that's training kids to do peer counseling and referral.
Yeah, I was
necessary.
And so, John, to that point, sorry, Ann, to that point, the peer-to-peer suicide mental health first aid training that the coalitions are looking at funding in the schools are for 9th, 10th, 11th, and 12th graders. And Julie has investigated this. I got all this information from Julie. And then in the school, 10% of the staff has to be trained also. So, like if there were 28 teachers, then 3 people would have to be trained, 3 adults. But if you count all the staff, that will be a larger number. And so then that will be a larger pool of adults that will be trained. So if we do the peer-to-peer mental health first aid for teens, there will be 10% of adult staff in all of the high schools who will be trained to do this also.
Could we add in school staff just as a group in that list?
Yeah, I think that's really appropriate. Thanks, Jenny.
Mm-hmm. Whatever the percentage is, school staff does need to be included.
And Julie, I'm not trying to kill you, but I'm again thinking that you are likely a good person to kind of lead the charge on this. Okay, thank you.
I'm totally there for Julie.
Yeah, me too, Julie.
Yeah, thanks, you guys.
I don't feel alone in this, and I think you guys are all amazing to where we'll all figure this out together. And because I am speaking with all the schools, and it is a conversation with every single school about mental health first aid in the schools, and it just makes sense. So absolutely.
Is there a reason we shouldn't include parents in opportunities for training?
No, I think we should include parents too. I think that's also a good call out. Thanks, Jenny. I honestly think we had kind of assumed parents and teachers, but I think it's better to call it out. So I think that's a good shout out. And then I left 2 placeholders in there, but I think actually if we get a list of adults and we put on the training, we've really, accomplished that strategy. So, but if anybody can think of other activities that would be required to make that happen, it's a good time to add them now.
Are we at all concerned about not having a metric in that area?
The metric is 50 adults are trained in suicide prevention, but we probably should put a date by, but I was afraid to do that until this group kind of weighed in.
Yeah, fair enough.
But can we put a date on it? Can we say by the end of 2022? That gives us quite a bit of wiggle room. Julie, Denise, Tanya, Jenny?
When we Lori and I talked about this yesterday briefly, and we were thinking, because we are looking for funding for it, that it definitely would not be until at the earliest next semester sometime. So, sometime after January.
What if we gave ourselves to the end of, see, we're in 21, so the next school year will be 22. What if we gave ourselves to the end of the 2023 school year? So we get the funding, we get the buy-in of everybody that you need buy-in to, and then you actually get to execute the training.
That's what I was going to suggest.
6/2023. Does that seem reasonable to folks?
Yeah, we could say by 6/2023.
Yeah.
It seems more doable.
Have to go, so.
Okay.
Hi there.
I'm super sorry, but I have to go too. So I totally apologize for that.
The good news is we're pretty far along in this, so appreciate all your feedback, folks.
Well, and there was a last item on the agenda where I was going to report out, but what I was going to report out has already been reported out. It's all this information about the peer-to-peer mental health first aid. So.
Okay.
All right. Thanks. And
Thanks,
sorry
Denise.
again.
No problem.
Yes, and I'm a minute from also having to head to Bremerton.
All right. Next page, Lori. Let's go before anybody else drops. And then strategy 1C is about peer-to-peer counseling. And the first activity is research tools for teens, provide them with guidance on how to interact with peers, verbalizing plans or desire to commit suicide.
It sounds like this is already kind of being done, for instance, at the meeting that's happening that Denise told us about with C. Meyer. So maybe this, or maybe we just say that Denise is on top of it.
Well, I'd say Empowered Teens Coalition and ESD maybe for this one. Again, this is what happens when you leave a meeting, you get assigned work, so it's perfect.
Is this also where the teen-oriented suicide first or mental health first aid course could come into play?
Yes, that I know that's one of the options that they're actually discussing as a tool to use. But I think there were folks that thought there might be some other options for that, and that's why we didn't call that out specifically. But I know that is one of the tools that they're talking about.
When we say teens, are we talking about only high school or middle and high school?
No, I think middle and high school.
I would like to be a bit more optimistic then and bump up the metric to at least 10.
Okay, I think that's reasonable. And is there a better term to use than teens? Should we say middle and high?
Middle or high school and high school students.
Middle and high school students.
Yeah.
Or youth.
Youth can be a fifth grader. I think we need to narrow it down to middle and high school students. Well, that's a good question. I think they're going to be, if we're going to be talking about suicide prevention at all, I know that there are some things being done even in the elementary schools. But I think if we're going to focus on particular peer-to-peer training, I think we do need to be specific to middle and high school students.
It might be tricky to get 10 students from Brennan.
It says at least, so.
But if we said at least 10 from each school district, that might be a tricky one. I don't know how many.
It's an up to.
Oh, okay.
It's at least, it's not as much as. It's at least 10 students. If we don't get 10 from Quilcene, it's okay. But we may, who knows?
Yeah, actually, in some ways, saying at least 5, it doesn't limit you, but if you turn it the other way, you could do 2 and say that you hit it. So in some ways, I prefer to leave it.
What if we were to use a percentage instead of a?
Oh, that's a good idea, Anne. Let me talk to a couple of school superintendents that I work with pretty regularly and get their thoughts about what a reasonable percentage would be. Is everybody okay if I do that?
Sure.
Okay.
And that would be of middle and high school students.
Yeah.
I mean, Julie last time was saying that the class sizes are what, 20 to 30, right? So if we were to go down the mental health first aid route, which is an evidence-based and easily accessible route to go down, especially since her therapists are getting trained in that as trainers already. So if the group size is 20 to 30, that could give a starting point for what this metric could be, with a goal of like at least one group going through from each district or from each school, perhaps.
That sounds good, Anne. I'll reach out to, the school size Brennan has, I think, like 34 students or something like that. So the school size.
So if they offer one class, maybe they offer it to the whole.
Yeah.
Well, they don't have high school either in Brennan.
Yeah. So it'd just be the middle schoolers there. Anyway, let me massage that a little bit. Next page, Lori, except I think we might be at the bottom.
I think you're at the end.
Okay. Yeah. So
John, I need to jump off in a second, but I did notice that there aren't any tasks or strategies or objectives for any of the mental health organizations like DBH or us. So I don't know if we would like to join in and do some of the work as well.
I also wondered if there was a piece around that, ensuring that the ways that the handoff happens between the hospital and the communication, in whatever ways it can happen. It seemed like there was some discussion about exploration around how we could make sure we're not dropping people between our various services, if that's something that we should include.
Yeah, actually, Lori, I thought that was in there. So maybe the version we have got knocked off somehow. So why don't you and I do some checking on that? And Molly, I think when I come back next time, let me think about the Jefferson Healthcare and the DBH involvement. And I, as far as I'm concerned, on most of these, more is better. Sometimes it's nice to have single responsibility, but on a lot of these, it's really going to be collaboration between agencies. So let me take a roll at that. And then the next time you look at it, it'll have that and you can tell me if I have it in the appropriate places.
Okay, I guess I feel like the responsibilities as they're placed now make a lot of sense. I don't think, Jefferson Healthcare has a role in the schools really right now, for example, or, with mental health first aid, but we do have our own responsibilities for being sometimes the first touch point for people seeking help, and making sure that we're doing a good job of that, and coordinating between organizations seems like a reasonable ask of us. So something that fits into our wheelhouse makes sense to me.
And Susan, I'm already kind of planning to add some activities around the SBIRT. So that will definitely be in there. And I think, folks have to drop off, and it's 5 minutes, just kind of an announcement. We have 2 more meetings, but I think actually the framework is really pretty close. And the next meeting, the majority of things we'll be talking about, making sure we have the responsibilities right. The next meeting is August 5th. There actually is another meeting scheduled for like August 20 something, but we may not need it depending on how the next meeting goes. So I feel pretty good about the framework the way it is now. Are the people who are still on the line kind of at a thumbs up point of view if we deal with the issue of coordination of care and kind of have the changes that we talked about today?
Yeah, I mean, I generally, yes, but I just want to second Molly's thoughts about, making sure that we're thinking about Jefferson Healthcare's role and also DBH's role. I think there's probably likelihood that both organizations are going to be working on these things regardless, but it would be nice to have a central place where we can be coordinating and making sure that we're not doubling up efforts.
Yeah, I agree. And I think we actually had something in there about that, Ann, so I'm going to go back and take a look at that.
Yeah,
so.
I know, we were talking about it last time, so
yeah.
We'll just add that in. And I know we've got some ideas internally, and also if we're thinking about the whole zero suicide framework that's come up before in these meetings.
Yeah,
that would help us to get everybody on board in the same project.
Yeah. All right. Well, thanks everyone for being here today, and we're on the home stretch. Really appreciate all of your work, and it's really exciting to be nearing the finish line. So thanks again.
Thank you.
Thanks everyone.
Bye-bye.